So we're going to be doing spine palpations, or cervical spine palpations. So I'm going to find the base of the skull first and work my way into the middle and palpate the spinous processes. Coming down, 3, 4, and 5. Going off of the 5, I'm palpating the transverse processes. So 5, 4, 3, 2, and I'm back up to the base of the skull. Working with the musculature, the upper traps, palpating all the way distally. Erector spinae, palpating bilaterally, working all the way down. The sternoid, glenoid, mastoid, all the way into the anterior of the neck, palpate bilaterally. And the scalenes, anterior, middle, and posterior, and palpating bilaterally. So we're doing active cervical range of motion right now. I'm going to have the patient in neutral starting, and then I'm going to ask her to tilt her head down to the floor, cueing her chin to chest, and going to look up towards the ceiling, watching for any curvature in her back. Bring your head back in neutral, please. I'm going to have you look over towards my finger, over your right shoulder. This is lateral rotation, and look over to your other side. Last one is side flexion. I'm going to have you bring your ear to your shoulder. I'm going to do the same to the other side.
Yep.
Going to do myotomes right now. C1, C2, C3, C4, C5, C6, C7, C8, and then T1. And during this, I'm asking the patient if she feels this sensation equally and bilaterally. For C1, hold this. Don't let me break you. Perfect. For C2, bring her into a head extension. Putting force on the occiput. Hold. Good. Relax. C4, go ahead and shrug your shoulders. Hold. Don't let me break you. Perfect. C3, I'm going to laterally flex you. Hold. Don't let me break you. Perfect. C5, going to bring you out into chicken wing. Hold. Perfect. C6 is elbow flexion and wrist extension. Going to test the wrist extension first. Hold. Good. Hold. Good. C7 is elbow extension and wrist flexion. Going to test wrist flexion. Hold. Good. Going to test elbow extension. Hold. C8 is ulnar deviation, putting the patient in that position. Hold. Don't let me break you. Perfect. Going to splay out your fingers, finger abduction, and this is testing T1, and I'm basically bringing her fingers into adduction. I'm testing bilaterally to see if she has equal and bilateral strength in both extremities. The second nerve I'm testing is the ulnar nerve. Have the patient supine again, head in neutral, depressing onto her shoulder complex. Arm is abducted and supported by my leg. I'm putting her into elbow flexion, wrist extension, and forearm supination. I'm going to have a patient be in this position for about 30 seconds, and a positive is a reproduction of pain, numbness, or tingling in the extremity. And I'm testing the ulnar nerve, and to make the test go one step further, I'm going to ask the patient to, while I have her arm in this position, to laterally flex her head away from the tested arm. You can relax. All right, so I'm going to be testing the upper limb tension test, and the first nerve I'm testing is a median nerve. Having the patient supine, can I have you scoot closer to the edge of the table, please? Thank you. Depressing onto her shoulder while keeping her shoulder abducted about 90 degrees. I'm going to put her into extension and supporting her with my leg. I'm putting her wrist into extension. Her fingers are going to be into a fist, wrist extension, and then I'm gradually extending her elbow. And this is testing the median nerve, and a positive is a production of symptoms including pain, paresthesia, numbness, tingling. To make this test a little further, I would ask the patient to tilt her head away from the tested arm, laterally flex, and if this produces symptoms, then it's a positive for hyperirritability of the nerve. So the last nerve I'm testing is a radial nerve. I'm going to have the patient standing for this one. I'm going to put her in shoulder abduction, shoulder extension, and internal rotation. So basically her thumb is pointed down. This will also pronate her arm. And I'm putting her in wrist flexion. And I can ask her to laterally flex her head away from the tested arm. And this is testing the radial nerve, and positive is pain, numbness, or tingling to this nerve. I'm doing the Babitsky test now. I'm going to take a tool and I'm going to scrape the bottom of the patient's medial arch. And a natural response is toe flexion. However, the positive of this test is great toe extension. And this is a sign for the primary motor cortex being damaged. This is the Oppenheim test, where I'm taking a tool and I'm scraping the patient's medial tibial crest in a distal to proximal movement. And a positive is great toe extension. And this is a sign of cerebral irritation in the patient.
Alright, so for this test, we're going to be doing the cervical compression test. This is testing for the narrowing of the intervertebral foramen. A positive test is going to be a reproduction of pain, numbness, or tingling. So I have the patient short sitting like this. I'm going to get a both on the same pressure on top of her head, and I'm just going to push down into a compression. I'm going to ask the patient, did you have any numbness, tingling, pain with that? Not at all. So like I said, a positive test would be the reproduction of pain and numbness and tingling that could occur. So I'm going to be testing cervical nerve root distraction test. What this is doing is going to be testing for compression of the facet joints throughout the spine. So all I'm going to have my patient do is lay supine like this. I'm going to stabilize under the patient's head around the neck. And then all you're going to do is apply the distraction force, so pulling out. And a positive sign of this test is going to be the reduction of the signs and symptoms she's had. So if she was complaining of pain or sharp shooting, tingling throughout her spine, by doing that test, it would diminish. So for this test, we're going to be testing for nerve root impingement. This is going to be the Sperling's test. A positive test is going to be reproduction of pain and numbness and tingling. So I'm going to have the patient still short sitting, sitting up nice and straight. I'm going to have them lateral flexion of their head. All right, in this position, I'm going to do the same as a compression. So I'm going to push down right here, see if there's any pain, discomfort, any numbness and tingling, which she is not. We could also test bilaterally, so having the patient come to the other side and go through anything at all. So like I said, positive sign is reproduction of pain. So this test is the vertebral artery test. It's going to be testing the vertebral artery itself. So for this test, the patient's going to be supine, and I'm going to stabilize the patient's head. So I'm going to extend the patient's head. I'm going to have them open their eyes while doing this. And then you're going to side bend. And what I'm looking for is any unequal reaction of the eye movement, nystagmus. Also looking to see if that has any pain with that, or if she is experiencing any nauseous or any other symptoms out of the blue. All right, so we're going to be testing the brachial plexus. So this is the brachial plexus traction test is for anything, any damage that has been done to the brachial plexus itself. So what I'm going to do is put tension on the brachial plexus by having the patient side of it. So I'm going to apply the pressure to her head and push down on her shoulders, really stretching her trap and brachial plexus. A positive sign is going to be increase of pain, paresthesia could happen, or any sharp shooting pain. So I'm going to be testing for herniated disc or nerve root impingement. The test I'm going to be doing is shoulder abduction. So this test, what I'm going to have the patient do is have you adduct out your arm and then place your hand on top of your head. This is shortening the brachial plexus space. So a positive sign for this test is going to be a decrease of signs and symptoms. So this should reduce the amount of tingling or sharp shooting pain that they might be having.